Hello everyone. Today in this video we are going to learn about a lesser used medicine in our clinic, Syphilinum. Before that, if you are new here, this is Dr. E.S.Khan, founder of OrganonEasy. OrganonEasy is an organization with a motto to promote private practice based on homeopathic philosophy among our students. In here we discussed practice related tips and productivity related tips. So let us start with the video. Syphilinum is a medicine which has been lesser known to many and used not used very often in our clinic. We don't know much about the use of Syphilinum. So today we will try and decode the prescribing symptoms of Syphilinum. Remember that our video and our motto of OrganonEasy is to promote private practice. So we everywhere we only deal with the practice related practical tips and how to enhance the use of philosophy in our practice, day-to-day clinical practice. So we will skip all those academic part, that what is nosode or how these nosodes are being prepared, or who were the first provers, or how this medicine have been introduced. All this you will get in textbooks. Refer to textbook for those related information. Here we will discuss only regarding the practical utility of this medicine. As all of you know that Syphilinum is a nosode, obviously prepared from a disease product, syphilitic disease product. So how we can study this nosode? This nosode can be studied based on current presentation. Instead of telling it the present complaint, we are telling it current presentation. Why? We will know in a while. This current presentation has a background. A man who came to you for his current presentation or present complaint has a background of sufferings or his life history. Okay, that background and that suffering, the man has came to you at the age of 30 years, but this before 30 years period, he has a background. That background is being called as past history. His past history. Okay, this we call anamnesis. From present complaint going to past history. This past history includes both medical history, both his medical history and his circumstantial history and his circumstances, the emotions, the conflicts, the circumstances he has or have faced in those years, all those years, that includes in past history. Okay, so this past history is important from the point of view of homeopathic prescription. That should be known to all of you, that this past history is very important on our prescription. We can discuss the importance of past history in some other lectures, but today just I want to emphasize on the past history of this Syphilinum. So this current presentation has a past history. Okay, this current presentation of your patient has a past history. This past history is coming from where? This is important from the point of view of homeopathic prescription. Those who are not from the homeopathic background may not understand this clearly. So this past history obviously coming from family history. Okay, before this family history there is a transition zone. Okay, there is a transition zone, and that is intrauterine life history. Okay, So we will read syphilinum under these 3-4 headings: current presentation, past history, what was the intrauterine history, okay, and what is or what may be the family history. Okay, so this current presentation includes two things. Okay, what the patient is telling you, present complaint of the patient, and what you are able to observe. Okay, on observation, the physician's observation, that has been referred many a times in Organon of Medicine, that it is important what physicians have, what physician, as a physician, you have observed in your patient. There is a article in the Racer writing of Hahnemann, that is medical observation. So that is also important, and that is also included in current presentation. And even if the present complaint is not matching with the syphilinum, depending upon all this history you are taking, you can prescribe syphilinum. Any complaint modified by the peculiar modalities of syphilinum, any complaint, be it pain in head, be it pain in abdomen, be it pain in extremities, any complaint modified by the peculiar modality of the syphilinum. And what is that peculiar modality of syphilinum? Modality of syphilinum is the aggravation at night, the syphilitic aggravation. It is not only the modality of syphilinum, but it is the modality of syphilitic miasm itself. Okay, modality of the syphilitic miasm is the nightly aggravation. Okay, any complaint modified by this modality is syphilinum. Okay, you may think of syphilinum, peculiar modality of night aggravation. And what kind of aggravation in the night it is? It is the as if the night is reaching to its peak, the complaint is aggravated, and as the dawn is coming, the complaint is ameliorated. It is the rhythm of the night to which the syphilitic patient or syphilinum patient aggravated or ameliorated. So any complaint, first present complaint, you can have any complaint modified by this peculiar modality. Okay, now any complaint having bilateral symmetrical presentation. What is bilateral symmetrical presentation? These are what you are able to see on your screen. These are the bilateral symmetrical presentation of the complaint. Okay, you will get the in this you are getting that skin eruption, and similarly bilateral symmetrical on both the hand. You are getting any complaint, even if any pathology, the pathology of calcaneum spur, bilateral symmetrical. Okay, I will narrate a case where I have been guided with this bilateral symmetrical pathology of calcaneum spur to prescribe syphilinum. Okay, so bilateral symmetrical. What are the other medicines of bilateral symmetrical? These in the Patak repertory, you are getting other remedies of bilateral symmetrical complaint. Arnica, thyroidinum, syphilinum, kaliiode, all these medicines are having bilateral symmetrical presentation of complaint. Any pathology, even if any pathology you are getting a bilateral symmetrical presentation, think of syphilinum. Okay, so any complaint having bilateral symmetrical presentation, any pathology, even the vocal cord nodule, okay, having the bilateral symmetrical presentation, think of syphilinum. Okay, now present complaint includes the area of affection. What is the area of affection for syphilitic miasm? The area of affection for syphilitic miasm is trachea, larynx. That includes vocal cord. That is why I was telling vocal cord nodules at bilateral symmetrical position. Okay, larynx, trachea. Here in the Roberts you will find the guideline of that. Bilateral symmetrical regarding the affection of syphilitic miasm, and the affection of syphilinum. You will get palate affected, both soft palate and hard palate. You will get larynx and trachea, vocal cords affected. You will get bones are affected, meninges are affected, spinal cord and brains are affected, eyes are affected. These are the affected area for syphilinum. So any complaint in those affected areas, okay, in those affected areas, any complaint if you are getting, think of syphilinum. Okay, now on observation, what and more often you will get some present complaint like the frozen shoulder of right shoulder, or frozen shoulder with the pain at the insertion of deltoid. This is one of the most common symptom of syphilinum you will find, or bilateral symmetrical frozen shoulder, okay, with the pain modalities aggravation at night. Okay, so any present complaint may be modified by these modalities, may think of syphilinum. On observation, what you will find? You will find on observation some constitutional defect if you are getting, okay, like cleft palate, okay, like high arched palate, okay. High arched palate is one of the indication for syphilitic miasm and syphilinum. Any constitutional defect you are finding, or asymmetrical faces like this, pot lips like this, or there is parallel cracked on the tongues like this, okay. These parallel cracked, these are on observation, current presentation, but patient is not telling you that I am suffering from parallel cracked on the tongue, okay. So this is your observation, and you can reach syphilinum through these current presentation. Clear? Now this clear. Now this present this past history, what you will get in the past history? In the past history you will get in patient of syphilinum, first of all, he might have suffered at some point of time, he might have suffered from syphilis itself, the disease syphilis itself with suppression. That is number one point. In past history, you might have found, you may find that a history of alcoholism is there. A history of alcoholism is there. Okay, alcoholism. Patient may have left it, or maybe it is coming in here also. Alcoholic patient. Okay, you will find in syphilinum written that cannot live without alcohol. Okay, this alcoholism is so in deep rooted that you will find this in family history too. We will talk about that. So alcoholism in the past history or in the present complaint, you find this, you may think of syphilinum. There may be some history of congenital heart disease which has been repaired. Okay, patient will tell that I have suffered from fossa ovalis. Okay, and that has been repaired. That is also coming under this serrated teeth. Okay, serrated teeth are Hutchinson's teeth, what you call, is coming under current presentation on observation. Okay, on observation we have told that cleft palate, cleft lip, some constitutional defect or asymmetrical faces, or alcoholism in the past history, or maybe in the present history. You may find this in present history too. Okay, past history may include some depressive psychosis, and that patient may have come out of that. This depressive psychosis may be in present complaint too. Okay, this past history may include some attempted suicide. Okay, attempted suicide may be included in this past history. Okay, just after birth, what all diseases have patients suffered? Just after birth, if the patient have suffered meningitis, okay, if the patient have suffered some spinal cord disease in his history, meningitis, or some severe brain affections of the brain, what it indicates? It indicates the syphilitic miasm at its prime. Okay, affection of brain. This on observation also in current presentation, you will find patient wearing thick glasses, high refractive index, high refractive power of glasses patients are wearing. You will find children of 2 years or 3 years wearing thick glasses. What does this indicate? It indicates the affection of eyes are so grave that patient is wearing a power of -12 or a thick glasses to accommodate the seeing capacity. Okay, so this may be in current presentation. You will find a patient may have suffered at some point of time just after birth, may have suffered neonatal ophthalmia neonatorum. Okay, what it indicates? It indicates a syphilitic base. You find the history of ophthalmia neonatorum. Go a bit beyond to that, you will get a history of a mother telling that the child has not cried at the সঙ্গে সঙ্গে কানে নেই ডাক্তার বাবু, he just didn't cry just after birth. A late crying is a history you can utilize for prescription of syphilinum. Delayed crying, okay, or maybe in the history you will find the constant crying of children. You will find that ডাক্তার বাবু এতে 3 মাস অবধি কেঁদেছে, কেউ ধরতে পারেনি কেন কাঁদছে কিন্তু কেঁদেছে. Okay, that is the constant crying of children, past history of constant crying of children. That is also a history you can think of syphilinum. Okay, go beyond that. IUH, intrauterine life history. You will find during intrauterine life history, before that, before this conception, you will find history of recurrent abortion. Before that, okay, history of recurrent abortion. You may find history of monster child born, okay, or stillbirth or dead born. Before that, just before the conception of this child, there may be history of monsters, there may be history of dead child, there may be history of macerated child, that is monsters, there may be history of recurrent abortion that may be utilized for the prescription of syphilinum. Okay, now come back to family history. In family history, you will find some grave diseases like cancers. Okay, in family history, you will find insanity, schizophrenia. Okay, in family history, you will find alcoholism. This alcoholism is there in forefathers and uncles, siblings, everywhere you will find alcoholism. Okay, so deep rooted this desire for alcohol is alcoholism. Okay, you will find suicidal deaths. Okay, in family history again you may find early age, death at early age. 30 বছরে মারা গেছে, 28 বছরে মারা গেছে due to some grave illness. Okay, death at early age in some close relative, mama, pishi, bhai, বোন, এই ছোট বয়সে মারা গেছে, heart disease, heart attack হয়ে মারা গেছে. You will early age death. You will find sudden death, হঠাৎ করে মারা গেছে, sudden death. You will find sudden death in father, in siblings. জানি না ঘুমিয়েছে উঠতে পারেনি. Okay, this sudden death is an indication for syphilinum. Okay, so all these are basic points for thinking of syphilinum. So any of the drug in Materia Medica can be read in this fashion. So let us recapitulate in a quick manner. Syphilinum in current presentation you may find with present complaint. Okay, any type of present complaint with the affected area of syphilitic miasm, that is eye, spinal cord, brain, larynx and trachea, vocal cords. These are the affected area for syphilitic miasm. any present complaint presented with bilateral symmetrical presentation, bilateral symmetrical presentation, any present complaint qualified with this peculiar modality of night, rhythm of the night, aggravated and ameliorated with the rhythm of the night, you will get coppery skin eruption of coppery colored skin eruption in your syphilitic patient, like this. Now that point have been had been missed during discussion. Now this was present complaint, current presentation, present complaint. Now this present current presentation on observation. On observation, you may find the cleft palate, cleft lip, high arched palate, bilateral symmetrical, asymmetrical faces, all this. Any constitutional defect, that any high power of glasses, thick glasses, wearing of thick glasses may be indicated of syphilis, miasm and syphilinum. This current presentation. In past history, you will find the history of alcoholism, the history of depressive psychosis, the history of insanity, the history of syphilis itself, history of some grave diseases suffered at past, history of delayed crying, history of constant crying, history of some congenital heart diseases. Okay, so on past history you will find all this. On observation, one more point was that irregular teeth or serrated teeth. In intrauterine history, you will find just before conception there was history of recurrent abortion. There was history of recurrent abortion, history of monster, history of stillborn, history of deadborn. Okay, so this was in intrauterine life. Now in family history, you will find family history of cancers, family history of insanity like schizophrenia, family history of alcoholism, family history of suicidal deaths, family history in some close relative sudden death, family history of early age death, family history of some diseases which should be occurring at later age, that diabetes mellitus should be occurring at a late middle age or early middle age, but the patient was suffering from 17 years, patient's siblings were suffering from 17 years of age, 18 years of age, or juvenile diabetes mellitus. Okay, so this early history of some grave diseases. So this is in short syphilinum we can use in our clinic. Okay, if you have any query regarding syphilinum, or if you have any suggestion to add to the knowledge of syphilinum, you may comment below. Thank you for giving your attention.